Once we explain what a professional patient advocate is, most people agree it's a needed service. Independent patient advocacy is a relatively new field. We are hired by the patient, their family, their caregivers, or friends to help navigate the complex medical system. Our primary focus is being an objective advocate for our client. In order to be the best in this field, a patient advocate should have spent years in all disciplines of medical specialties. You don't need to have been in medical school. More importantly, a patient advocate needs to understand medicine from the patient side. I've helped people throughout my 30-plus years with medical errors in billing, medical management, research studies, hospital encounters, medical speak, reimbursement, and countless other areas. In the industry, I've been between the large corporations and the medical team assisting the real end user in getting what they need and deserve for successful outcomes. There are patient advocates employed by hospitals. Sometimes the term is patient navigator, but they focus on the hospital goals. This makes sense. They are part of the hospital system. Our focus is on the patient. When I'm asked to be an advocate for a patient, I may show up to appointments and take notes during the medical conversations. We find there are so many questions for the doctors and staff, but not knowing how to ask these is common. We can work with you to find what you need to know and how to ask questions in the right fashion. I follow up on instructions with the office staff to be sure the plans can be carried out seamlessly for our client. I decipher what is said so the non-medical person can understand the diagnosis and/or the best way to get a fix to the problem. I can observe the interaction and ask deeper questions to better uncover uncertainties the client may have. After 30 years in the medical field, I have learned how to interact with medical professionals in a productive way to get a better understanding for all. Many medical offices embrace what we do because we clarify the issues, saving time, and reducing misconceptions. We work with insurance matters, scheduling transportations. We can write report to other family members. This happens when a loved one cannot be in the same town or at every appointment and medical encounter. We can be on hand for hospital stays. When authorized, we can review charts and talk with medical staff in the hospital to get a better understanding of timelines, care, release dates, etc. Transitions from hospital stays are also an area we can assist in. If there's a recommendation for short-term or long-term care in a facility or home, we can be a resource for planning, vetting, and coordination. Understanding test results is a real critical part of healthcare. After years in the lab business, I know how to speak the language of lab results and billing. We can also speak insurance. Our goal is to improve access to care for our clients. We know how to go at it through other channels. When you're not feeling well, you may be required to make some of the most important decisions of your life. We are there to help you through these times, and if need be, we can bring in other experts. My passion is oncology and hematology. I've spent the last 17 years in this area and understand all different forms of cancer and know many in the profession locally that can help me help your loved one. I hope now you understand a little bit more about what a professional patient advocate does for you and your family. Please reach out to our website, email, or phone listed and see if we can help.